guys have put yourself out there to make this big ask. And I'm glad to say we have an answer for that.
It's the news he's been waiting to hear. We take you along as the big surprise is revealed. And this one gives a whole new meaning to taking one for the team. Good morning. It is Friday, November 11th. I'm Jessica Lovell. Welcome to the Morning Medical Update. We are live inside the Dolph C. Simons Jr. Family Broadcast Studio. Today's program is pretty special for us. That is because we get to share a personal story from two team members here at the Medical News Network. So make sure you get your questions sent into us on the links right there on your screen, or you can drop them in the chat thread below. We'll get to those in just a few moments. Well, don't you just love a surprise? Well, so do we. And we are going to let you in on a big one. Alex Brown's search for a new kidney has been a year in the making, way before he'd even started working for us here at the University of Kansas Health System. But he had no idea when he took this job, he'd finally met his match.
I'd like to kind of present you with something.
Oh, hi.
Hi.
Hi, lady.
Hi.
How are you? It's good to see you.
I'm not here to offer you this award. I'm going to offer you something a little bit more personal. So you guys have put yourself out there to make this big ask. And I'm glad to say we have an answer for that. The committee met last Wednesday, or this Wednesday, and I'm your match, man. I'm your match. Yeah.
You guys.
The committee met. This is happening, dude.
Oh my God, thank you.
This is happening. So, yeah.
How do they drool into your body and then put it in a kidney?
That's
so much better.
These guys can tell you.
They're gonna do it.
It's magic. Yeah, they're gonna take one out of here and put it in there. Mm-hmm.
Look at her face.
That's easy.
Thank you guys so much. It's so good. That's the best thing.
That's awesome.
And we are so excited to welcome Alex and his soon-to-be kidney donor, Logan Blankenship. These guys are usually behind the scenes, making all of us look really good. But they are both right upstairs above us in our transplant center this morning. Guys, good morning to you.
Good morning.
Good morning.
Hello, good to see you. Looking good up there. In studio, we also have Dr. Tim Schmidt, Director of Transplantation, and Dr. Sean Coomer, Transplant Surgeon and VP of Perioperative Services. Guys, good morning.
Good morning.
Can't do any of this without you guys either.
Well, it starts with those two guys on there.
And it ends with you.
We can't do it without them.
I know. Such an exciting time. We are also joined by Chaplain Becky Johnson this morning. We're going to explain the spiritual connection to organ donation here in just a few moments. Chaplain, thanks for being with us. We'll get with you here in a minute. But Alex, I have to start with you. This all started with a pretty routine medication regimen, right?
Yeah, so in January of 2019, I was diagnosed with ulcerative colitis, and I was put on a medication that's a pretty routine medication for that illness. And I was on that medication for cumulatively about 15 or 16 months between a couple doctors and the insurance lapse and these kinds of things. But to treat my illness, I was on this medication, and it's prescribed to most anybody with any IBS, Crohn's, ulcerative colitis, those kinds of illnesses, yes.
And what was that moment that you realized that there was something wrong? Because as you had told me before, this normally takes years to show up if there's a problem. And this showed up within about, what, 18 months?
I mean, yeah, from when I started taking the medication to when I ended up at the emergency room in Olathe. Yeah, so what happened is that I never felt anything really different. And so this is kind of typical of anybody that has any chronic kidney disease. Sometimes that they don't really even feel anything before it's a problem, like a major problem. And so I had some blood work done with my doctor, my GI doctor at the time down in Texas, and I get a call while I'm visiting up here in Kansas, some of a family in here in Kansas that, oh yeah, by the way, you need to go to the ER, and so that was heck of a call, and so yeah, I ended up getting checked into the hospital, and they did my blood work there again just to make sure everything was what was going on, and yeah, my creatinine number was at 9.8, and anything above a 10 is pretty dangerous, and obviously it's outside of normal range and everything, and so it was a scary moment for me and my family, just getting that call and then being in the hospital trying to figure out what's going wrong with me. We finally had a biopsy done the Monday after the weekend I was there. It was the weekend of my anniversary, so that was great. Thanks Jenna, my wife. And we found out that I had what we call drug-induced interstitial nephritis. So after they did the biopsy, they determined that it was the medicine that did damage to my filtering ducts in my kidney. Yep.
Alex, what was it like when you heard that you were going to be put on the transplant list, or that you might have to go out and ask someone to check and see if they're a match?
Yeah, that was another shock. Obviously, another thing that was like it took me aback that. I knew that I had these kidney issues and that I was, my kidneys weren't doing great. I'm very thankful for my nephrologist that we visited in Texas at the time, and he put me on a good regimen of medication to kind of keep me going, get inflammation cleared out in my kidneys, and kind of keep me going to where I am now. But I found out that I was needing a transplant after I moved back up here to Kansas. I came to the University of Kansas health system, and yeah, they said you need to start looking for a living donor. I'd never imagined having to go and search for a kidney at the time I was 34 years old.
So you're being treated here, then you get a job here,
yes.
And you sit just a few feet away from the guy that's sitting right next to you this morning. Logan, you knew of his story. You've learned about his story ever since he started working with our team. When did it start kind of coming together in your head that you might want to secretly go get tested to see if you might be a match?
Well, as part of my job here, it's our job to tell the stories, and I've been fortunate enough to be in Dr. Coomer and Dr. Schmidt's ORs quite a few times, and those stories always just kind of resonated with me. And so once, Alex joined us, that started kind of clicking in my head that there may be something here, there may be a reason for this, and that was a while ago, and then I kind of just assumed it was getting taken care of. Like I knew people were getting tested, and I just kind of assumed that, hey, this is probably happening for him. And then found out that sure enough, some people stepped up, or at least one person, and it didn't work out. And I knew, like I could see in him, that he was devastated by that, and that was a big setback. So I said, you know what, I'm just going to see if maybe that match works for the two of us,
and just see where it takes you. So
yeah.
I want to talk more about that, but take us inside. It's a 2-day long screening process that you went through to find out that you were a match. Kind of take us inside. What were they doing up there?
Yeah, so they just took me in for some labs, a few blood tests, and it was 2 days, about 4 hours in those days. So they take you for all the labs, and then you talk to a bunch of folks who really lay out like what to expect. They want to make sure that if this process goes through, you're not going to be hit with any surprises. So it was quite a few labs. And then just talking to a lot of people. So that's basically what the 2 days were. The second day was a lot of scans. So they were just trying to see where everything was, placed and where they could get access to it. But it was a very painless process.
So, Doc, let's talk about that. You really want to make sure that he's ready mentally, physically, that he's at the top of his game, and that he can withstand a surgery. Dr. Coomer, you always say you got the hardest job in this hospital because you're cutting into a healthy guy.
Well, I don't know if it's the hardest job. It's just it's the one that just caused me to lose all my hair, I think. I always tell folks, and I was obviously very surprised to see Logan not in our operating room, but in our clinic. A little bit of a shock there, but it was really kind of cool. And I always tell folks, and I told Logan, I said, you'll be the only person here at KU that day getting an operation you don't need. So it ups the ante. Everybody getting operations hoping to be better on the other side. And the best we can hope for Logan is to keep him the same. Mm-hmm. God forbid, don't want to give him anything worse. So our first responsibility is to the donor. We want to make sure that he's not going to wind up in a situation that he would have renal disease later in life. So it's a very, very thorough process to make sure no problems come up.
Dr. Schmidt, just talk to us a little bit about what goes on. You come in, we're all, how does that work? There's a big team of people asking the right questions, and then it's a committee that has to decide, right?
Yeah, like Dr. Coomer said, I think our first priority is safety for the donor. That's a huge ask to give your kidney to somebody else, but you also want to come out the same as you went in, and we have to make sure we do our due diligence to check these people out to make sure we're not going to hurt them. But in the end, the recipient of the living donor is the one who does the best, because they get the kidney that's going to work the longest, work the quickest, and it's a trade-off win for someone to go through the donation process to get that kidney away. And I think it's great, watching these two guys. We know these guys, and seeing them, it's going to be stressful. I think I might lose some hair like Coomer.
I think so.
I hope you do. I hope you finally do.
I know you do. Well deserved, though. Well deserved. You guys have put work into that. Logan, I want to go back to you, because before all of this big surprise, this conversation started at home with your wife, your son, and your foundation, which is God-based, faith-based, and you put a lot of that into this decision. Kind of walk us through that.
Yeah, so the initial conversation went kind of as you would expect it with a wife. She was, and she gave me the quote here yesterday. She said, cautiously supportive was kind of her initial reaction. But then we walked through kind of all the information that was given to us and all that. And honestly, it came out in a very matter-of-factly tone, like, hey, we can deal with this is going to kind of put us back a few weeks, a couple months, but in the grand scheme of things, the payoff for, when you look at what it's going to benefit Alex's family and what it's going to cost that doesn't, that outweighs the cost-benefit ratio is real huge there. Alex is going to, get years and years and years of benefit from this, whereas it's just going to kind of be something that only affects us for a couple months, and she was on board.
Well, and you said this is a gift. You said this isn't Logan's gift to Alex. You said this is the Blankenship's gift to the Browns, right?
Absolutely, because that's ultimately there's going to be a little while where I'm not able to help out with all the day-to-day things, and C knows that she's gonna have to kind of pick up all that slack, and without hesitation she's like, that's not a factor. Like, I got this. I got Jericho and I got this. You're good to go.
All right, and speaking of picking up the slack, you two, are going to be out together at the same time? What are we supposed to do without you two? Alex,
Yeah, I know.
we will miss you.
I'm not gonna, things are probably going to go better than they would if we were there, but it's I just can't say enough about this guy and what he means to me, and just like everything that he brings every day. I mean, regardless of this this huge gift that he's giving, he's just an amazing person, and just he's so positive every day, and brings just a great vibe to our team, and just he exudes kindness to everybody, and this guy is that personified. He's amazing,
Well, we think the same of you, and you're going to have a piece of him forever and ever. And I want to hear more about the surprise and who at this table.
Yeah.
And I want to reveal who at this table isn't super great at keeping surprises.
You and I.
You started it. So we'll talk about that. I want to take. I want to turn though to our chaplain, if we can. Chaplain Johnson, Becky, thank you so much for being with us today, because this is Donor Sabbath. This is a time where churches and religious leaders and synagogues and places of worship all across the world encourage their communities to donate tissues and organs. And Chaplain, you say most religions do encourage donation, of course, with the premise that they're saving a life.
That's right. That's right. Most religions are very supportive of organ donation, whether it's a living donor or a deceased donor. They are very supportive. They're most, especially the major religions, Judaism, Islam, and Christianity, all are based upon saving a life, sacrificial love, and helping one another.
And I think you would agree we're seeing that here today with Logan and his friend Alex, right?
A great deal of love and compassion for each other, and giving of themselves. As Logan says, he'll be out 2 months or so, but it's a lifetime for Alex to receive this kidney of his.
And Chaplain, I know Logan mentioned, I remember he even said the story, Logan, I'm going to share, that you said you say I know you go on your walk every day, and you said there's a corner that you turn that you said your prayer for Alex and his family. Mm-hmm. So we know that people put a lot of strength in their faith during trying to make a decision like this. But what barriers have there been when it comes to religion and donations?
Some people have the conception that, what's going to happen if I can't be whole? Will I, for a Christian, will I have a resurrected body? And well, for me, my God is bigger than our human thinking, and we don't understand it right now. But I think in the future it will not make any difference. And the overall premise in the Bible and many of the religious writings of other faith groups is to love one another. To love one another with all your heart and mind and soul.
And give of one another, quite literally in this case. Yeah, please.
I was going to say, sometimes there might be ethical issues. People wondering, is this recipient worthy? In the case of Alex and Logan, they know each other, but if an unknown recipient, are they worthy of receiving my loved one's organs? That might be, some ethical issues like that could come up for people also as a barrier.
Sure. And Chaplain, before I let you go, tell us a little bit about what we do here at the health system. We're talking about living donation again today, but of course we have deceased donors and their families that we honor here at our place.
Yes, we started about 2 or 3 years ago. We started what's called an honor walk, and this is an amazing opportunity for all of our staff who are there at the moment when the patient is taken back to the operating room where the organs will be procured, for them to line the hallway as the patient and sometimes their family members walk to that surgical area. And at that time, we are just in awe of the gift that this family has determined that they will give to another person so that they can, sustain life. It's a gift of life to another person. So we line the halls, and they have an honor walk, and just to honor this hero that's going down the hallway to save others.
Well, Chaplain, it's so great to have you here as we head into Donor Sabbath this weekend. We are all learning what that is. So that was so wonderful to know that we're honoring folks, and that religions everywhere are encouraging those to give that gift of life. So thank you, and thank you for what you do for our patients and their families here at the health system.
Sure. Thank you.
Let's turn now to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count this morning. And of course, we're keeping track of RSV and those flu numbers. What you got for us today?
Yeah, I mean, it's such a shift. We definitely want to get back to this story. But real quick, so active COVID count right now, 19 active infections, 1 in the ICU, 0 on the ventilator, still 15 in that recovery period. And, we heard Dr. Fauci say a couple weeks ago, the death rates from COVID are still way too high. That is absolutely true. Again, most of those deaths are coming with unvaccinated people who are not up to date, and or especially with those other immune compromising conditions. So it is very important as we get into the winter to remember to be up to date on your vaccines, as well as get tested early, get on Paxlovid or some of the other therapies if the monoclonal antibodies are still working, and just get that done to help reduce your risk of severe disease and, of course, death. And then we also have the RSV and influenza numbers. Right now in the hospital, we have 17 RSV inpatients. The range for this is quite broad, 2 weeks to 77 years old. We have 3 in the pediatric ICU, with unfortunately 2 of those patients on the ventilators. And you can see the ages of those very, very young children in the ICU, 2 weeks, 4 months, and 4 years. And then in the ICU, we do have adults as well, a 77-year-old and a 36-year-old patient. Unfortunately, one of those patients is on a ventilator as well. Influenza, again, influenza numbers aren't as high. And again, typically, our influenza numbers don't get as high as the COVID numbers have been. But we do have 4 inpatients, and that age range there is quite broad as well, even a pediatric patient, 15 years old. But luckily, none in the ICU, and of course, then none on the ventilator. So unfortunately, we are still seeing severe disease from these other respiratory viruses, not just COVID.
All right, thanks for keeping an eye on those numbers for us, Doc Hawk. Thank you. Any reporters on the line today? Okay, we're going to get to community questions in just a moment, but I got to talk about the surprise. Okay, Logan, watching you the day of this all coming together, you and I, we sit pretty close to each other too, and about every 6 minutes, 8 minutes, I'd go, hey, another 6 minutes has gone by. Hey, it's 2 minutes later than when we last looked at the clock, because we knew that this was happening, and we were so excited, and I was just excited watching you prep for this and watching this all come together. But how did you know you were going to kind of do it this way?
Well, I mean, it's all just part of that kind of divine setup. We've been, like I said, covering these kind of stories for years, and we've never really nobody's ever shown us that moment where you get to kind of reveal this part of it. That's never been shown to us, or we haven't seen it really captured very well, and we just happen to be in a place that has a lot of cameras and a lot of microphones. So I'm like, well, let's go ahead and roll on this. And our team did a great job at capturing it. And the other tricky thing was we work in a newsroom environment. We're all former TV newsroom folks, and just a little peek under the hood. It's impossible to keep a secret in a newsroom because that's just the nature of us. And by the time this thing finally concluded, I think we only had 2 people out of our entire team that didn't know, and thank goodness Alex was one of them.
I was totally oblivious to what was going on. I thought I was going in for one of our department meetings or something like that, and we were sometimes we use the studio for our meetings, and I didn't think anything of it, and I was surprised to see my family there and everything, and I had no idea what was coming. No idea. You all got me so good.
Oh, we loved it. We loved it. Yeah, you were oblivious. And guess what? I was oblivious too. I was walking down the hall outside our office, minding my own beeswax, and I passed this man, and I was long gone, and he turns around and he goes, hey, do you know about what's going on Friday? And I go, oh, really? What is going on Friday? And then he kind of, his eyes got big, like, uh-oh, uh-oh. And then he said that Logan knows about something. I go, well, why does Logan know about this? Why does he get to know something I don't know? So I couldn't figure it out. So it was so fun. And you guys don't get a chance to see this part of the story. So what was it like, though, to be standing here and like watching it all come together there on video?
Yeah, that was a lot of fun. You know, it was tearjerker. You know, it was funny. You know, I mean, Alex's daughter was there, and she's the cutest thing ever, and she's just, you know, full. I mean, she looked like a kid on Christmas, right? It was just really cool, and so did Alex. Alex looked like a kid on Christmas too. But yeah, it was just a lot of fun to participate and just be there just to see it, because it was just so heartwarming and wonderful.
Yeah, watching Jenna, your wife, like gasp and put her hand. I mean, I knew in that moment she had no idea what was going on, Alex, but I watched. That's my favorite part, I think, is watching her, like when Logan said, we have an answer for you. How's Jenna doing with all this? My gosh, I mean, the weight of the world has got to have somewhat come off her shoulders.
Yeah, tremendously. I mean, it's just it's been a huge relief for us. I mean, it's been on our minds for more than a year now, and then ever since I was diagnosed with my kidney failure, and it's a huge weight off our shoulders, and you see it in the video, just like the weight being peeled off. I was in shock, so I had nothing to say, and I am hardly emoting because I'm like, I don't even know if this is real right now, and it was, but it sank in, and it's such a tremendous blessing, and I am so thankful.
We all know you are. We know you are. And I remember sitting here watching. I go, oh, I think Alex is in true shock. You're very often without words. Not very often. You usually have a lot to say. And then you are completely silent. So I've got a couple of community questions I want to get to, and then we'll wrap up because I think you two are off to surgery.
Correct.
So I will let you out of here in just a moment. But how do you decide which healthy kidney? Let's say Logan has 2 healthy kidneys. How do you know which one to take?
Well, he better have 2 healthy kidneys, because one's going to be gone, so the one has to be healthy to keep him along. Usually we take the left kidney, and that has more to do with the recipient than anything else. Mostly it's because we can get a longer portion of artery off of the aorta, and also a more robust and longer vein for the renal vein. And that helps out my partner over here when he gets to sew it into Alex's pelvis.
And what's the recovery process like? Because once you put that, tell us what you get excited about when you put the kidney in. Tell everyone what you love to see.
It's my favorite operation, one, because you get to see guys like this doing their thing and making the other person happy, and then the kidney functions immediately and makes urine and squirts on the table, so it's always cool to see the actual kidney start making urine right in front of you.
Doing its job. Yeah. We love this. Yeah, it's such a cool thing. Amanda wants to know, when is this transplant happening? Do we know, guys? Is it on the books?
It's not on the books yet. There's a couple things I need to make sure I have covered up with my UC before we can go under the knife. And so it likely sometime next year, early part of next year is what we're hopeful for.
Jennifer has a question. Can other drugs, like what Alex took, cause this kind of problem? Is this something that we need to be more reading the tiny print when it comes to that, or asking our physicians before we start on some regimen like that?
Yeah, I mean, obviously Alex had a pretty impressive side effect to that medication. Like was mentioned before, this was pretty quick. And usually it doesn't happen that quickly. It's usually prolonged exposures, and there are other medications out there. Probably too long a list to name some. Lithium is one of them. This is one of them, and there's a lot that a lot of medications we take have side effects, and they are broken down primarily by the liver and kidney, and so that can sometimes raise these issues. So it's important while you're taking medications that you have routine follow-up and laboratory values to make sure you're okay.
And just lastly, Jim wants to know about the recovery process. We said a couple months for Logan. Is that about accurate? And then what about Alex?
Yeah, I'll comment on Logan's, and then I'll kick it off my partner here, Dr. Schmidt. So I always tell the donors that this is actually a more painful operation than the recipient. So you're giving the gift of an organ and gift of pain a little bit, and you sort of pay up front. First couple days are pretty rough, and we do some things to try to mitigate that with nerve blocks and so forth. But we usually say for the first 6 weeks after surgery, no heavy lifting greater than 10 pounds or a gallon of milk. You can basically walk and go up and down stairs, and we want that. We encourage that. But usually after 6 weeks, you can start doing things a little more normal. If you want to work out and stay active, but only if it doesn't hurt.
All right, Dr. Schmidt.
Yeah, it's pretty similar. Patients with kidney disease often have such a slow decline in their function that they feel actually better in the first few days after the operation. And then the incision itself takes a few weeks to kind of get to a place where it's more comfortable, but by 4 to 6 weeks, most people are feeling pretty well after a kidney transplant.
But it's true because they don't realize how bad they've been feeling, and
yeah,
then
it's
they
such
get
a
it.
slow decline. It's like throwing it, and they all of a sudden realize, wow, I did decline in my health and my energy and my feelings, and they feel pretty good right away.
Right away. I want to put some information up. We have a QR code that I want to put on the screen. It will take you to more information about our conversation today, some of our transplant services, and then find out if you too could be a living donor the way Logan has chosen to be. So click on that for more information. I want to get to our final thoughts. And Chaplain, I want to start with you. We talk on this show a lot about faith and science living beautifully together, and this is certainly an example of that. Just your final thoughts on as we think about the idea of giving that gift of life.
Sure, I do believe that faith and science can go hand in hand. Doctors, medicine has been provided with the information and the technology and the procedures to be able to do these transplants, and our faith gives us the background of hope and love and giving to one another. And I would encourage people to become organ donors if they can, to sign up on the registry, and then be sure and let your family know. I've told my kids, take it all when I'm done.
Fantastic. Docs, I'm going to get final thoughts from you so you guys can scooch on out. Dr. Coomer.
Yeah, I really just want to thank every donor, living and deceased, past, present, and future, and as well as Logan, right? I think these are the ultimate gifts. Pretty incredible. It's saving somebody else's life, and I'm just proud, honored that I get to participate in it. I'm really honored that you allowed Dr. Schmidt and myself to be here in the studio when we saw that surprise. Thank you very much for including us.
Dr. Schmidt, final thoughts.
Yeah, I think donation crosses all probably faiths and the religion. It's the golden rule. I mean, it's similar in all religions if you really go down into diving into those religions, and giving of a gift like this is probably the best one that fits that description. And yeah, that was great to be a part of the surprise. We're never a part of that surprise, and I think we're always in the kind of the apex of all this stuff, but being down in the foundation and seeing how the stress of the disease and the anxiety and the real kind of personal feelings that people have with the problems that we get to fix is kind of really humbling to see that, we get to help people like this.
Yeah, to watch that moment when those stresses
the stress and the anxiety of healthcare and chronic illness is something that, I say that to my kids all the time. It could always be worse. Be thankful for what you have, because if you really think about it, most of us have pretty gifted and pretty blessed lives.
Yes, well said. Thank you, Docs. And I want to let you guys get your final thoughts in. Logan, Alex, who wants to go first?
Well, yeah, I'll go first, and just touching on the conversation of faith. My wife and daughter and I, every night, for the past more than a year, we prayed for this. We prayed that this would happen, and that God would find a way through this for us, and and it happened. Logan is truly an answer to a prayer for us, and this is not just serendipity. I just want to get that out there. This is absolutely divine intervention, and there's no other explanation that this circumstance happens for me, and I'm so eternally grateful and thankful for this guy. I mean, he's the light of my world, and my family is too, and it's just I'm really blessed with this guy.
Oh, well, I don't know how to follow that, but my family's the same way. I mean, we are very faith-driven. We try to operate on God's nudges. We try to listen. We try to stay open to those as much as possible. And this was a big nudge. This was absolutely a big nudge. The other thing we feel God teaches us is to love one another despite the risk. And that's, there's hopefully a lot of people listening to this today. I want to encourage you to find that way to love somebody despite that risk. This is the way I found. This one dropped into my lap, but I'm encouraging you, find that way.
Well, we love you both so much. It's like a family here, and you guys are part of our family, and we support you and love you, and we're with you every step of the way. And Logan, I guess this means I'll have to be doing all your heavy lifting for a couple of months.
Yep.
Is that what? It's a funny way to get you to do that.
At least a year.
Yeah.
Oh, it's a year now. It was 2 months.
And don't forget, not just Logan, also Alex.
Okay, so I'm going to be carrying 2 jugs of milk. Okay, great. Got you guys.
right.
I got you. I'll do it. I can do it. Dr. Hawkinson, final thoughts.
Yeah, I mean, just continue to echo on that message of faith and science. We've said it here. Dr. Stites has said it. It is so vitally important. Find that aspect of faith. We have the great surgeons, medical professionals, physicians to help with the science, get you through. Working with Alex and Logan for the last couple years, we know Logan is just continues to be a relentless giver. And I will give you, once after the show, I will give you your Christmas presents early. I have 2 Band-Aids for you for your transplant sites, so I'll get those to you after that.
Your little,
Bigger one.
a little boo, just a tiny boo-boo.
That's all we could get.
Okay.
But I will also pledge my services to Dr. Schmidt and Dr. Coomer, anything they need in the OR. I don't know that you want it, but I will actually do good hand hygiene, so it will be very good technique for that.
Perfect. Okay, guys, this has just been a great conversation, a great way to end our week and head into the weekend. Thank you to all of our guests. Chaplain Johnson, thank you, everyone. Let the honoring continue. The University of Kansas Health System is honoring, of course, our veterans on this Veterans Day. There is a TAP ceremony at 11 o'clock this morning at the Murphy Courtyard at the KU Medical Center campus. Plus, our KU dining services, they are offering free meals to all veterans at all campus locations if you show up at any of them today. Just bring your ID for that. And then there's a special blend of coffee at the Health System Roastery. Of course, there is absolutely no way to honor our veterans as much as we can and should, but this is a small way to recognize those who have served our country. So thank you so much for being with us today. We will continue to bring you along and share more of Alex and Logan's journey. We're just really excited to be a part of it, and we're glad that you're with us on this road too. So you can catch our updates, of course, anytime by logging back onto Facebook, YouTube, and Twitter. Go out, make it a fantastic weekend, and we'll see you back here Monday at 8. In the past 20 years, adults diagnosed with diabetes has more than doubled. Type 2 diabetes is by far the most common. I'm Jessica Lovell, coming up Monday on the Morning Medical Update. It's a tempting time of year for those living with or trying to avoid type 2 diabetes. We share 3 food changes you can do now to help get you through the holidays.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.